Well, unfortunately, yes, but they're not new. So as you know, and that's why we're here today, oxygen is often simply not available where it is most needed. But those shortages have been a problem for decades, especially in low and middle income countries. They've been there long before the COVID pandemic hit. And the pandemic itself then, of course, exacerbated those shortages and caused millions more preventable deaths and really exposed the deadly consequences that those shortages can have, as well as the inequity in access to oxygen between high income and low income countries. But the barriers that low and middle income countries have been facing haven't changed. And Leith has already mentioned many of them. So there is inadequate healthcare infrastructure, a lack of oxygen itself and oxygen equipment, a lack of trained workforce, healthcare workforce, biomedical engineers. There are fragmented markets and supply chains with one or maybe only a few dominant suppliers, which leads to prohibitively high prices for oxygen. A lack of sustainable financing, both at the international level as well as at the domestic level. A lack of data for monitoring, for reporting, for oversight. There are often regulatory constraints in countries, or a lack of just planning capacities or policies or roadmaps in the first place. And then there's insufficient engagement with the affected communities themselves. So the barriers are still there and they haven't gone away, but the advantage is we know what they are now and we know how to address them. So again, the call for action is really just to work together as a global community, make use of the global health, the Global Oxygen Alliance, the partnership, the strategy that the Global Oxygen Alliance will shortly publish together with an investment case. Take that seriously, work together as a global community to implement that strategy, because we cannot achieve universal health coverage, maternal and newborn health, primary health care, the health targets of the Sustainable Development Goals without medical oxygen.